Hi everyone, I'm Shelby Farrell, Behavior Support Specialist with Montgomery County Board of Developmental Disability Services.
And I'm Brian Katchmer, also Behavior Specialist with the Montgomery County Board.
We hope everyone's staying safe and healthy during this time. Today we'll be talking with you about the Behavior Support Rule, focusing primarily on defining behavior, how to access the rule, reviewing basic requirements of the rule, knowing how to tailor strategies toward the specific needs of a person, and the importance of gathering data to evaluate the effectiveness of the strategies currently in place. Let's go ahead and get started. So what is a behavior? Oftentimes we find ourselves forgetting that behavior is simply communication. Behavior is a response from someone based on internal or external stimuli. Sometimes we don't always see or know how to support someone because we don't always hear them say, "Hey, I need help." But instead, their actions begin displaying their need for support. We'll talk more about that in a couple of slides. But for now, let's take a moment to do a small activity. Think about everything you did in the last hour. Either write it down or have it in your head. I'll give you a minute or so to think and jot down some responses. Okay, maybe your list includes things such as doing the dishes, taking the trash out, getting dressed for the day, etc. But what your list likely didn't include were the things that went wrong. You woke up late, you didn't have enough time to eat breakfast, and you didn't have enough time to pack your lunch. More times than not, when talking about or describing an individual to someone, we tend to focus on the non-compliant or negative behaviors, such as they property destruct, they're self-injurious, or they elope, all of which I'm sure you've heard before. Be mindful of remembering this activity the next time you're asked to describe someone you work with. Their days are often laid out just as ours are. Let's do better to focus on what we would do and how we would describe ourselves. The behavior support rule can be found at the two links that you see pictured. This rule applies to all providers, including agency and independent. The rule also states that behavior support strategies are no longer a part of their plan, are no longer a part of their own plan, but instead strategies are now incorporated into the ISP and DINA. The plans are no longer separate so that preventative measures can be a bigger discussion that focuses more on teaching, educating, and supporting the client served. With this change, as a team, we should see more support provided and avoid focusing on how to de-escalate only when something happens. An example may include a client's need for sensory input throughout the day. Hopefully, we see the plan focusing on how do we meet that sensory input? What activities can we offer in order for that need to be met? This may include going on walks, passing the ball with staff, and going on car rides to desired location. Being proactive will help the support staff and the client served achieve success, rather than us focusing on how to respond only when a risk is displayed. It's important that staff keep in mind that when risks are displayed, a lot of the material in terms of redirection and approach is collected by behavior tracking and UIs. It's important for staff to provide as much detail as they're able, including what worked and what didn't work. Strategies and supports should also take into consideration environmental, mental health, interpersonal, and emotional needs of the person served, and will be updated annually or when needed due to change in status, programming change, or additional supports are needed or are no longer needed. Prior to distribution of the plan, it's important that we ensure that the guardians and individuals served consent to what's in the plan, especially if those plans include restrictive measures. So as I just mentioned, other factors or triggers to keep in mind when working with a person may include environmental, mental health, interpersonal factors, as well as their emotional needs. All strategies are individualized and person-centered, written based on what will benefit the person served when feeling anxious or upset. Let's get into some examples of the factors or triggers mentioned above. An interpersonal example may include a client's relationship with their staff and the ability to rely on that specific person to help them calm down when they're upset. It's important that staff avoid placing too many demands and creating a power struggle, but instead focus on supporting and offering alternative, preferred activities to help somebody calm down. Environmental examples may include a schedule change, currently being experienced by most people right now during the pandemic. Routine and consistency is important. Having alternative activities planned may help in reducing anxiety when an unexpected schedule change occurs. A medical example or factor would be a person experiencing pain that's not visible to support staff. This may include a stomach ache, a headache, or a toothache. They're unable to relay their pain or symptoms to their staff, but at this time, it's important for staff to observe changes in their behavior. That may include self-injury, vocalizations, change in their eating habits, and change in their energy levels. It's important that staff administer pain medication if prescribed. Emotional or mental health factors that may change somebody's behavior. Losing a favored staff or family member, increase in anxiety due to changes in schedule, lack of sleep, canceled plans or med changes. It's important that staff remind them of their safe place, provide support, and ensure that changes in mood are relayed to the team members. A risk may be defined as a person served being in a situation that may cause injury or harm to themselves or other persons in their immediate environment. Their safety is no longer able to be ensured either. A risk may be defined as eviction from one's home, the potential of arrest or incarceration. Let's talk more about how to determine what a risk is. The first question you'd ask yourself in a potential crisis situation, will this cause harm or danger? If the answer is yes, intervene immediately. If the answer is no, move on to asking yourself, will this cause embarrassment or disappointment? If yes, then use this moment as a teaching opportunity for the person served. If no, proceed to the next question. If it's a personal choice, be supportive. If it's not a personal choice, return to question 1. An example with the same person but 2 different scenarios. You're at Carriage Hill. You're in the back of the park, on the walking trails, and far enough away from any potential hazards. The individual begins walking or running away from supervision, but you can still see the person. Do you intervene? Most likely, no. In some cases, your reaction might even cause them to start running or walking further away. It may become a game. Ensure you remain within visual and auditory range. Now consider this scenario. You're at Carriage Hill, towards the front of the park, surrounded by busy traffic. The individual begins walking or running off. What do you do? At this point, it's likely that if they get too far away, you're no longer able to ensure their safety. It's safe to say that you should probably intervene. Lastly, I'll be talking to you about restrictive measures. What are they? What are the specifics of them? And what are prohibited actions? So what is a restrictive measure? A restrictive measure is a measure of last resort that should only be used in situations to ensure someone's safety. A restrictive measure requires approval by the Human Rights Committee. The use of a restrictive measure requires data and documentation of other strategies that have been tried and have proven unsuccessful. A manual restraint is a hands-on method. Examples include blocking, holding, restraining, or disabling a person's wheelchair. A mechanical restraint is the use of a device to control someone's behavior, maybe a buckle boss or a harness to be used during transportation. Timeout is defined as confining a person to a room or preventing that person from leaving. The door is to remain unlocked at all times, and staff have to be able to see that person in order to ensure their safety if they were to begin causing harm to themselves. A chemical restraint is the use of a medication to control someone's behavior, oftentimes a PRN. If a PRN is to be administered, a PRN would be administered in order to control someone's behavior when they might start displaying signs of anxiety. This would be outlined in their ISP. Rights, as enumerated in 5123, requires for the person's Bill of Rights to be reviewed annually. A prohibited action or measure is defined as a method that should never be used by any person or agency. Examples include a prone restraint, when a person's face or front part of their body is facing downwards or touching the ground or any surface for any period of time. Prohibited measures also include the use of any mechanical or manual restraint that has the potential of causing injury to a person, restricting a person's ability to breathe, or is not medically approved due to underlying health concerns. Prohibited measures that are often not thought of may also include, but are not limited to, disabling an individual's communication device, denial of breakfast, lunch, dinner, snack, or any sort of beverage, placing a person in a room with no light, subjecting someone to painful sound, squirting an individual with any sort of substance, and using any sort of punishment to teach someone or enforce a consequence.